Hi, my name is Heidi Fairborn, and today I'm going to be talking to you about the social determinants of health that will have an effect on incarcerated youth. So the first thing that we're going to be talking about is a description of who we're actually talking about. So on any given day, there are nearly 48,000 children that are detained in correctional facilities. You can see in the graph over here the breakdown of where these youth are. We've got some in detention centers, some in long-term secure, and that is like youth jail. They're serving sentences there. Detention centers are where youth will go when they first get into trouble and need to be held while they're waiting for court, or kind of while they're waiting for things to be solidified as to what's going to be happening to them. Residential treatment can be voluntary, it can be court-ordered, and a lot of that is for substance abuse or for behavioral issues or for mental health issues or for kids who are just not suitable for school environments. You've got adult prisons and jails and then group homes, which are here. So what's interesting is that all of these can really be court-ordered, where these two will be locked. These ones, the kids will have a little bit more freedom. What's really interesting is for most of the youth who are here, they are held for low-level non-violent crimes. That was something that was really interesting for me to find out about this population. So the size of the population, data for the local community for kids in JJS, that's protected information, and so I wasn't able to get an exact number on that. I do work in a detention center, and so I gave you an estimate of what we had in the beginning of February. You can see what the numbers are. For statewide here, 1354 youth served time in all of 2020, and this just comes from the Utah JJS website where they reported their numbers. Then there's nationally roughly 60,000. It's tricky because kids are coming in and kids are coming out to get an exact number on that. And then internationally, estimates are over 1 million children are jailed worldwide. Utah, it sits in an interesting spot. You sit about in the middle when you're looking at youth jailed per capita, because Utah has got some really great laws that have just been passed that are making it illegal for children to be jailed for a lot of the reasons that they might be jailed in other states. There's been a really big movement as of late to try to get and keep kids out of the juvenile justice system, because data shows that if they are in the juvenile justice system, they are more likely to actually go to prison once they become adults. So when we look at the social determinants of health for these kids, you can look at it two ways. You can look at it pre-facility or inside the facility. I kind of jump back and forth and try to cover both of those. But a lot of the kids are lacking in all of the areas of social determinants of health. They might come from a family of abuse, a family of poverty, family where their mom and dad haven't graduated high school, which would give them less ability to have insurance, and living in poor neighborhoods, which have higher rates of crime typically. So they're lacking in all areas of social determinants of health. I chose one of the 355 areas that they're trying to focus on for the 2030 Healthy People. And I think this would be a great goal for the Utah JJS community to focus on, and that is to increase the proportion of children and adolescents who show resilience to challenges and stress. This is a great quote. I'll read it for you. Research conclusively establishes that children who are abused and neglected, children who drop out of high school, and children who are arrested as juveniles are at a greater risk of adult incarceration. So if we can teach these youth the skills and give them the tools that they need to respond appropriately to the stresses and to the hardships that are in their lives that we really cannot take away, all of them, if we can teach these youth how to appropriately respond instead of violence, instead of drugs, instead of activities and gangs, we're more likely to be able to keep them out of prison and give them their lives back. Contributing factors that would cause the youth to become involved in the juvenile justice system. We've got learning disabilities, mental health disorders, diagnosed and undiagnosed, history of poverty or neglect, victims of abuse, drug use, trafficking, and unfortunately, race is huge. There is a really disproportionate amount of minorities, especially Black males, who become involved in the juvenile justice system. What was really interesting is this school to prison pipeline that I kept finding over and over and over again in the research. And it says that we are taking kids out of school from detention or expelling them. And that inevitably leads to this slippery slope of them ending up in prison. I'm going to talk a little bit more about that in the next slide. But so these root causes here are what would put them in the JJS system, and then the children really could benefit from education, counseling, and rehab services rather than being locked up. So the school to prison pipeline, what is it? Back in the 1980s, when the war against drugs came out and the zero tolerance laws came up against drugs, it was also given to schools for zero tolerance for any type of violence in schools. They were trying to create safer schools. And what happened is these schools were given the freedom to create a safe school in any way that they saw fit. And so they could expel people for dress code, for bringing toy guns to school, for getting in a fight with a peer. They could be expelled. And I'm definitely not saying that violence is okay, but if we look back at the previous slide, kids who are getting in fights at school might have a learning disability or an undiagnosed mental health disorder. They may be victims of abuse themselves, or they maybe were being bullied because of any one of these reasons. And what they really need would be education, counseling, and possibly rehab services. But instead of that, they are being expelled. They're being kicked out of school. This is a really amazing infographic to go in and look at, but basically what it comes down to is that the data shows that kids who experience being expelled from school are more likely to be expelled again, and that is more likely to lead them to the juvenile justice system. And kids who are involved in the juvenile justice system have a much higher rate of actually going to prison when they are adults. But things are changing for the better. The school to prison pipeline is slowing down. So since the year 2000, the amount of youth that have been in JJS has dropped over 60%. You can see this really high number up here, and it is dropping, which is great. But still, that's a lot of kids. Nearly any given day, 48,000 children are detained in correctional facilities, which is not good for their mental health, or we'll see later for their actual physical health. So again, going back to that goal for the Healthy People 2030, it's just helping them to respond appropriately to the stresses that are in their life. We talked a little bit about the laws, Utah and Massachusetts in particular, that are making a lot of infractions non-jailable. So students, where they used to be able to take into detention, police can no longer do that. And so it helps to keep them out of the system and into programs maybe like home detention, or there's a whole laundry list of other ways that we can help these youth instead of sending them to secure care areas. When we look at Maslow, I looked at it from two different aspects. We've got outside the facility and inside the facility. So outside of the facility, most of these needs are not being met. Inside the facility, they're definitely being given the physiological safety needs, esteem. We really try to help them to find something to be proud of responding positively when there's negative situations or negative emotions that come up in treatment. They may not feel love and belonging, but we are doing our best to show them what safe and respectful relationships look like. specific concerns for these kids. Inside the facilities, they are at a higher risk for communicable diseases or infections due to close quarters, this group of people that they can't really get away from. And so if one person has something, it is very likely to spread. And also lack of access to the outdoors. They go outside, but most of the time is spent indoors. And then outside of the facility, the data shows that kids who come into the JJS system are at a much higher risk of STIs and HIV. There was a really interesting study done where they surveyed JJS employees, and they all agreed, not all, but most of them agreed that it was important to teach kids about STI prevention, but only 2% reported that it would be their responsibility to arrange for tests and follow up for care, which is crazy because a lot of these kids who are in the JJS system maybe have slipped through the cracks, maybe haven't been in school, maybe didn't have access to community programs that would help them to identify an STI or HIV and allow those to be treated. Non-communicable diseases. So there was a study that I read where it said that youth involved in corrections have a profound mental health morbidity related to all of the reasons you can look at here. I specifically focused on the impact that COVID-19 would have on their mental health. So what was interesting with COVID is that if any of the youth tested positive, they went into 14-day isolation in their room and they could not leave, which was basically solitary confinement for 14 days. And there are policies in place that definitely limit youth's ability to be placed in solitary confinement because it's not good for their mental health. There's so much data that shows that it increases their risk of suicide and it exacerbates mental illness. But because of the pandemic, that's to prevent the spread, that's just what had to happen. So there's been a real, I think, negative impact on the youth and on staff because of the spread or trying to slow the spread of COVID-19. Concerns for self-care or self-harm. My biggest concern would be that the youth are autonomous and must initiate their own care. There's nobody there really asking them, oh, how are you feeling today? If they have an issue that's health or mental health related, they need to be the ones to bring it up to staff. That can be good because it teaches them to take initiative, but it also, a lot of the kids in there are used to having their needs not be met, and so they're not used to be able to ask for help. And so it can be hard and challenging for them to learn to take charge of their care. And then also transport to specialty care is really tricky because a lot of the youth who are in the secure unit are shackled when they are transported to specialists. And that can be embarrassing for them, and it's just difficult to make happen. Risk for harm by others. There's a huge risk for harm by other people in the facility, mostly youth related, not staff related. But because of that, there's lots of rules for walking in the halls. All the doors are locked. There's cameras. There's always 2 staff just doing their very best to make things stay safe. But youth have admitted to me that they've felt not safe because they're in there with other kids who are in there for a reason. So they always feel like they have to watch their back. And those are my references. Wow, I was impressed that I made it with that amount of time. Hopefully you had a chance to learn some things about the youth who are in the juvenile justice system and can see why it would be important for them to learn how to respond appropriately to the stresses that are in their life. And I think if we can focus on that for these youth, we can hopefully create positive change and keep them out of jail when they become adults. Take this as a learning opportunity and help them to create better lives for themselves and for their future families.